Welcome. My name is Peter Strong. I am a professional psychotherapist specializing in mindfulness therapy for the treatment of anxiety and depression and also obsessive-compulsive disorder, including what is now becoming called pure O or pure obsessive OCD. So this is basically the situation in which the mind is bombarded by intrusive thoughts. The kind of cognitive material that invades the mind can be in the form of just repetitive thoughts. It could be in the form of repetitive intrusive beliefs. It could be in the form of obsessive desire to hurt another person. It could be sexual in nature. Very often the intrusive thoughts take the form of imagery, whether fantasy imagery or memory imagery, as in the case of PTSD and flashback memories. These thoughts and images become very intrusive, taking a great deal of our attention and cause a tremendous amount of emotional suffering in the form of anxiety and also depression as well. So it's really quite common. Pure OCD, pure O is quite common. It's estimated that probably at least 1% of the population in the USA and also in the UK and Europe suffer from some form of pure O OCD. The best approach to deal with this is not to try and block those thoughts, because that reaction, that response of aversion tends to feed the intrusive thoughts themselves. It feeds the emotional charge that keeps those thoughts reoccurring in the mind. So we don't try to argue with the thoughts, we don't try to remove them, we certainly don't try to avoid them either. What we find is most effective is some form of exposure therapy. So exposure response prevention therapy has become quite popular, ERP, and the type of therapy that I offer online is called mindfulness-based exposure therapy, which is very effective indeed. So in the approach that I use, we deliberately bring those intrusive thoughts into the mind, but we train ourselves to remain as the observer. The habit we are trying to combat here is the habit of reactive identification, whereby we become the thought. We lose our identity as the observer and we become the object that is observed, which in this case is the obsessive thought or image. So that process of reactive identification is really what fuels pure O and other forms of OCD. Because the moment that you become captivated by the thoughts or the emotion and you start reacting, then that will feed the emotion that is fueling that intrusive thought. So we have to learn how to sit with the intrusive thought or image without reacting. And that takes some training. And that's what I will teach you during the online mindfulness therapy sessions that I offer. We will learn to meditate on those thoughts, taking each thought and making it the primary object of conscious attention. That's quite different than reactive awareness, where it's just running the show. Now we are training in becoming detached from the thought and becoming the observer of the thought, and that's a very different quality of consciousness, and that does not feed the emotional charge of the thought or image. So that's the first stage in working with OCD, intrusive thoughts. We learn to become the observer and cultivate that state of being the observer. And the second part of working with pure O thoughts is one of looking at the imagery of the emotion that is feeding the thought. So the thought itself is not actually the problem. The problem is the emotion that's feeding the thought, and that is generally fear-based or anxiety-based in nature. So we have to work with that emotion. Now, emotions work through imagery in the mind. The imagery of an emotion is what actually causes that emotion to take form, and then that emotion converts into thoughts and actions and so on. So we examine the imagery of the emotion, the fear or anxiety behind the intrusive thought. We work on changing that imagery, because when you change the imagery, you change the intensity of the thought. When you change it enough, then the thought loses its emotional charge, and then it will cease to be intrusive. So working with the imagery of our thoughts is very important indeed. And the same applies to those image-based thoughts, the fantasy thoughts or memory images in the case of PTSD and emotional trauma. The factor that really keeps those image-based thoughts active and repetitive in the mind is the intensity of the imagery itself, the nature of that imagery. The qualities of the imagery are what keep the thought alive in the mind. And typically, especially in the case of graphic fantasy images, and certainly in the case of traumatic memory images, those images tend to be very vivid in color and detail. They are very large in size and very close in our inner visual field. Those properties are what cause the distress and suffering associated with those image-based thoughts. So we need to change that imagery, and we can do so once we establish mindfulness-based consciousness, and we can look and examine the imagery without becoming lost and overwhelmed by reactivity. When we change the nature of the memory imagery or the graphic imagery and make it smaller, we can rapidly take away its emotional charge and essentially neutralize it. When you reduce the intensity of the color and make it very faded or black and white, then that will also deactivate the emotion. there are other properties that we can examine as well, but working with imagery is really very central to mindfulness therapy and to helping recover from OCD and these very distressing, pure obsessive type thoughts that we may be struggling with. If you'd like to learn more about how to work with your pure OCD using mindfulness therapy, and you like the idea of online therapy sessions via Skype, then do please reach out to me. Ask any questions you have about the process and how to set up online sessions, and I'll be happy to answer those questions. And then when you feel ready, we can schedule a Skype therapy session. Typically, people see quite dramatic improvements within 3 to 4 sessions. Because this approach is so direct, it works on the actual structure of those obsessive thoughts, how they work in the mind, rather than just talking about them or trying to suppress symptoms through some kind of medication or other treatment. That may be appropriate in some situations, but it's not going to change the underlying psychological process that causes OCD. You have to work on the structure of the thoughts and the way that you see the imagery of those emotions behind the thoughts in the mind. So please contact me if you would like to schedule online therapy sessions with me. Thank you.